Upasana, for you, when I was growing up as a physician in India, we had very few role models. And one of them was obviously your grandfather, Dr. Reddy, who built something ahead of its time, had a extremely bold vision, and the hunger and courage to actually execute and build something of so much value. And when you ask him and when you talk to him, the only thing that he'll talk about is patience. You care about patients and everything falls in place. So growing up in that family, in the largest healthcare provider in India, what were dinner table conversations like, and what made it? What was the conversation every day like?
Thank you for asking this question because it's so important. While my grandmother made sure that the food was excellent and even though there was a heated conversation, the food made up for everything. So if you see anyone in my family overweight, then you know she's the reason for it. But every day at the table, whenever we started with discussing family and would eventually end up talking work. I don't know whether that's one of the best family business practices, but that's how it is. Because Apollo was family. We grew up in that atmosphere. Today, it's very different, but we all grew up talking about work, making the people that work in Apollo part of our family. We all grew up together. So I used to walk the floors with my grandfather starting at the age of 5. Which kid would go on rounds at 5?
Yeah.
So when I walk into the hospital today, it's actually emotional for me. So it's like walking into a temple. So dinner table conversations were about not how to grow the business, what we can do better to change, to make the patients feel more comfortable, to make people feel at home. I don't like people coming to the hospital. Hospitals should never feel like home. But if you can do something to make them, to give them, to hold their hand also during this tough time, I think, that's what matters and separates us from the rest. Another thing that we always spoke about is how we can get the doctors to communicate better with the patients, because I think that's the core, and then get the management also to start communicating with the patients. And small things like our management would say, why don't you write this number on your hand and things will get better for you, giving patients some hope and faith in some way or the other. I think that was the focus of our dinner table conversations.
And a follow-up to that is what you could have done anything in life, and you chose to spend your career largely focused on health and wellness. Was that out of choice?
Okay. Well, I definitely wanted to do something else, but we were given no choice. So my granddad came to us and said, "You're born with this background. And with the ability to help so many people, are you just going to let this go away?" So let me tell you, I wanted to become a designer. So I went to him, and Tarun Teliani was mentoring me at that time. And he called up Tarun and said, "Make sure you say she's the worst designer ever." He did that. Then I got to know. So then I went to him and then I said, "Now, Tata, you have to help me. I'm going to become a designer." He said, "Sure, you must. I will support you. You can design the most phenomenal scrubs and lab coats." And make it easy, and then I said, I just give up. And then I said, I'm going to do something. If I'm in this space, I'm going to do something exceptional for this space. So from the time I started working, which was at the age of 15, he made me start working. When I was pursuing my college as well, every summer I would work for no pay. And even till today, I work for no pay. So, it's just a passion-driven business, and I'm very, very proud to be in it.
Yeah. And it's hard not to be passionate about it. When I've been to Apollo several times, to the different hospitals, you walk into the Chennai campus or the Hyderabad campus, there are tens of thousands of patients. It's hard to see. It's as crowded as the Kumbh Mela, and so maybe that's an overstatement, but it's incredible. It's God's work. I think that your family has been doing for decades, and the thousands and thousands of doctors and nurses and staff that is supporting that, and we need more like this. There's a lot to learn from the business practices, but also from the clinical practices that you.
I want to add to what our vision is right now. Our vision to grow is not about adding more beds. but to preventing the number of people coming to the hospital. So our whole vision has changed because that's the only way the world can become a healthier place. So our vision right now is to prevent people from coming to the hospitals. Otherwise, I do not think that any healthcare system can manage the world's disease burden.
How do you bridge that gap between demand and actually getting people motivated to take care of their health before they need to?
See, to be honest, there's not great publicity about health checks, which I think is so wrong. Where people think that, doctors and the medical system are looting you, but that's actually not true. The prevention is always better than cure. Everyone knows it. And the better you take care of your health, the lesser your hospital bills are going to be. But, the thing is, everyone knows this and it's in you. So I think that one is they should definitely be more campaigns on it. People, if they celebrate Diwali every year, they should also have a health check every year. Health check needs to become the next fancy high-end bag.
Yeah.
That, if you buy a Birkin, then you must get a health check worth 1.5 lakhs that you owe to yourself.
Yeah.
So, these are the parameters that need to change. And also we were discussing this. I'm going to share a dinner table conversation with you on prevention, which says that, nowadays people should look at health as a currency. So how healthy you are will determine how rich you are.
Yeah.
So, and
Absolutely.
if that changes and people can change that mindset and adapt to that, then I think that the whole preventive healthcare part comes in. Now, the beauty of India with preventive healthcare is that it is now becoming holistic. It is not allopathy anymore. Like I gave you an example of small numbers on the hand. Who knows, numerology could be part of it. And we've seen Ayurveda being a part of it and being very successful. We bought Ayurveda. And now, we are opening a new center in different parts of Europe. So Ayurveda and allopathy coming together is going to get you much better clinical outcomes. And we have science to prove it. Meditation, Dr. Deepak Chopra he did a study here at Harvard also. Basic meditation can reduce your diabetes and put it under control. Even your hypertension. This jargon is known to all of you. But how many of you actually practice it? So that is the place. And, the other thing that I want to say about prevention is that India is the place where the world can heal. And you will get affordable healing techniques, and affordable healing is in India.
Yeah.
That's where I draw the whole.
That's very well said. And, if you think about it, all of us, actually, let's do a poll here. How many of you have heard of a friend, family member, distant relative, or someone in their 40s and 50s in India who's got a heart attack in the last 5 years? It's surprising. We as Indians are getting, and there's a center at Mass General that basically studies this, but we're getting heart attacks early, and a lot of them are easily spottable fairly early. And this is true for a lot of other diseases as well.
Do your labs. It's very, very, very important. You must get, I'm obsessive about my health. So I do it every quarter because I'm on a path. But
what's the one thing you do for your health that is not common?
Well, I check myself every 3 months. I put myself on I set goals, which I can't achieve, but there are also goals that I want to achieve. And then I also always research what is good for me. So I keep changing my program.
Yeah, it's very cool. If you were to start a new company today in healthcare, what are the 1 or 2 ideas that you really like that you would want to build in?
You want me to go first?
Yeah, but you can't say prevention because you've said that enough.
Yeah. So one of my life purposes is to get more women into the workforce, because I think that women that are financially stable and financially independent have a direct correlation with the health of the nation. So more women coming into the workforce, I think, will really help the health index of a country. So I want to start a business. I don't know if I'll be able to, but I do want to start a business where I could take care of the kids at home and make life easy so that the woman can go out and pursue her career.
Very cool.
So like not a creche, but a higher version of that takes care of everything that a woman needs to do, because it's very hard to change cultural patterns. But if you actually take care of this one aspect, then the culture will slowly start changing. And women are fantastic. They can multitask. So having this back end system for them will help them get more empowered.
What advice would you have to a founder who's starting to build in healthcare today in India? Do you have any piece of advice?
Don't think about making money. Make sure that your conscience is clean and you're serving for a purpose, because that's the only thing that will take you forward. The money will come if it has to, but if you're actually solving for a purpose, because there's so many things that need to change in healthcare right now. And India is going to be the blueprint of healthcare for the world. We are sitting on so much data. We know what's happening. Our healthcare systems are fantastic. I'm very proud to say I'm an Indian. I'm very proud to say that we managed COVID much better than anyone else in the world. And managing so many people, so many diseases, I think that, we've kudos to my country. I'm very, very proud of it.
How are you viewing the opportunity to change the landscape of Indian healthcare leveraging AI?
So February 5th was Founders Day, and we launched something called Ask Apollo, which is the ChatGPT equivalent for health. And yes, we are sitting on all this data. And what it's doing is it's making our doctors work harder. Let me give you an example. My father-in-law, if he wasn't an actor, he would 100% been a doctor. So what he does is he always, if he has a condition, he takes his reports, he puts them in ChatGPT and now hopefully Ask Apollo, and then he gets the whole answer, because ChatGPT gives him everything. And then he takes that and goes to the doctor and questions the doctor. So when he goes to the doctor, he'll say, I know about this, tell me more that you've studied. So now the doctors also need to up their game. And what will this result in? It'll result in much better science coming into play, doctors going into more detail, doctors finally being challenged. Otherwise, people in India think that they are God. So, dealing with that is also, something that they are going through now. So technology is playing a great role in improving the access to knowledge that people have. The back end, it's doing a great job by helping the doctors get better outcomes for the patients in terms of safety and administering the right drugs. But it's also making the patients much smarter.
Yep, absolutely. Your father-in-law sounds a lot like my wife. The one person, like I have a medical degree, I've worked really hard for it, but she will never listen to me anyway. So it's an incredible opportunity of what India can do with, and I've got a signal that we need to take some questions. So, and remember, the best question gets a coffee with. Anyway, so please,
I want to talk about universal healthcare. And I know there are concepts of government hospitals and some pieces of it, but do you think India should work on a universal healthcare plan? And we all talk about it being a right for everybody, but where is India on it? And then the second part, just on the whole data thing, I know there's some digital initiative on healthcare by the government. So is there some work to share private information also and make it something more publicly available, so you could basically solve diseases with the amount of data you have in India?
Yeah. Wait, is this being recorded now?
I'll take that. So yes, we have something called Ayushman Bharat, and it is phenomenal, but people don't know how to use it. Corporate India is also covered by insurance, but people don't know what they're covered under. This is something that people need to focus on. To first understand what your insurance policy covers. Second is use it, because it is so brilliant. Do you know Ayurveda is covered under insurance, but people hardly know it and they don't use it. And these are some things that people need to know about. Ayushman Bharat by the Prime Minister's scheme is fantastic. People in different states are covered under this and healthcare is free for them. So when you talk about universal healthcare, we do have something fantastic for people in India. They just need to come out there. And now with the private partnership that we have with the governments, we are able to create models that get better outcomes for the people than anywhere else. This is in the rural areas. And we did a study with McKinsey Health Institute on this, and now the model is scalable.
I have a question on how Apollo is approaching the problem, or 2070 Health or Preventive Labs.
So I'll start. The thing is that this was a huge program for us. It was called NRI First. And it did so well because the children studying here were able to monitor and track their parents' health. Me sitting here, and I live less than 5 kilometers from my mother, I keep tracking her health. And imagine if all of you couldn't. So now there is a system where you can buy them their medicines, you can get on a call with their doctor as well, and then you can track their health. This is being done on Apollo 247. And if they have an emergency, you can register their number with the closest with the ambulance and the closest hospital, and they will come and take care of your parents immediately. So the whole system has changed with respect to taking care of the elderly. We are an aging population, and for that, I think Apollo has taken a step front. If you have looked at an acquisition that we made, and a collaboration actually with Apocos Rehabilitation, it's an Italian brand where we help the elderly get back and live their life with dignity. So this is something that elderly care is something that we are truly focusing on, because we believe that they also need to have a great. Sorry, I want to end on one note that, Apollo takes care of over 300 senior care homes free of cost.
Oh, wow.
And supplies medicines to them on a regular basis, because we believe that they need to lead life with dignity and empathy.